A lot of times people ask me, how do I sleep? I've got this back pain and I can't sleep very well. What position is best for me? And it's a good question because it really depends on a few different factors. Some people are side sleepers, some people are stomach sleepers, some people are back sleepers. And everybody has different preferences. So the first question would be, well, how do you normally sleep? But for those that are side sleepers, probably the best thing to do would be to continue laying on your side. But with that, making sure that you get your pelvis nice and even so that the weight of the leg and the hip isn't pulling your back into a position that will cause pain. Okay? So that might look something like this on your side. And for guys and gals, it may be a little bit different. Gals have a wider pelvis, so they may need a pillow between their legs. So for somebody like that, this may be a little bit more comfortable. A pillow between the leg, their head nice and supported, and they can just get into a good position. Additionally, sometimes people find that it's still not quite enough support, so they can take a little towel and put the towel under between their ribs and their pelvis. Okay? So if you just took a little towel, stick it in that soft spot between your pelvis and your ribs, and that'll give the spine a little bit more support. Kind of like so. All right? Now, people that are back sleepers, something supporting the knees, in a sense, to take a little pressure off the low back, particularly if there's tightness in the hips. So some people just don't lay well flat on their back, but if there's a little bit of support under the legs, and then they can relax comfortably. Okay, so for a back sleeper, this might be the most comfortable position. Okay. For people that are stomach sleepers, that's a little harder because it's not ideal to sleep on your stomach because it usually will irritate the back. However, if you absolutely have to and there's no other choice, then what you would want to do is to essentially elevate the pelvis a little bit so it's slightly biased into a position where it's slightly bent forward. Okay. So what I would do is put a pillow or two under the hips so it could look like this. And then we can sleep somewhat comfortably with our pelvis elevated slightly to give us a little bit of a bend through the front of our hips so that we can maintain our back in a more neutral position. So that's how I would handle sleeping for people with back pain.